Hi, everyone, and welcome. We are very excited to have so many folks on the call already. We are anticipating a good group today, so we're going to go ahead and get started since we've got a lot to accomplish in a very short period of time. So welcome to today's session. My name is Hunter Davis, and I'm a program manager at the Center on Gender Equity and Health at the University of California, San Diego. I'm going to walk us through the start of our session today, and we're very glad you all have taken the time to join us. Welcome. Next slide, please. So we do have French interpretation that will be available for our open session, the first part of our session today. Please take a look at the slide here to see how to make sure you're on the right channel. For those of you who are using this service, you can find the globe at the bottom of your screen and click over to the French channel. Today, you can respond to questions or ask them in French or in English. Unfortunately, we won't have this interpretation for our parallel sessions later on, but we will have some French speakers and a few other groups that can try to help out. But I'm going to leave us here for just a moment on the interpretation screen so that those of you who need to read through the French version to try and initiate this function can do so. And I think with that, we can flip on over to the next slide, please. A bit of logistics for today's session. You can use the chat and the Q&A buttons to share your ideas, but while the chat box will be turned off during the presentations, the Q&A box will remain open. We ask that you use the Q&A during those presentations, both to ask specific questions and if you have comments or additions. We don't have a ton of time today, so we'll try to reply to the Q&A questions that we're able to as they come in. But we'll also hold a few to discuss during the short open Q&A session later on. Next slide, please. Here's our agenda for today's discussion. We're starting off with a basic introduction as to why we're here and information about the learning collaboratives, leading into an overview of global findings from our evidence review on social norms programming for outcomes related to adolescent girls and young women. Then we'll focus on a snapshot of findings from Nigeria, Kenya, and India, and break out into 4 parallel sessions that you'll be able to select to join. Finally, we'll bring everyone back together to think through what will be next. Next slide. While we get started, we'd like to ask everyone to please go ahead and use the chat feature to introduce yourself. Share a bit about where you're from, what brings you to the session, and feel free to engage with others as well. No, I'm seeing a chat about audio issues. There's a chance if you are on the interpretation, you may want to click interpretation and make sure that you either have it off or you have it on French rather than having it on English. That might cause an issue. So I'd take a look at the interpretation button under More for those of you who may be struggling with interpretation or translation. But Princess, if you could go to the next slide, please. While you're introducing yourselves, I'm going to share a bit about what brings us together today. Our session is presented in collaboration with the Social Norms and Agency Learning Collaboratives, which are a global network of individuals and organizations interested in and working together to influence and shape work related to social norms and agency. There are 5 regional communities: Francophone Africa, Anglophone West Africa, Eastern Africa, South Asia, and a global community for those living or working in other countries or regions globally. Next slide. Across the network of learning collaboratives, we share one mission: to strengthen research and practice on social norms, gender, and agency by building a network of practitioners, researchers, evaluators, and advocates who share knowledge, generate evidence, and develop resources to support social and behavior change programming. Next slide. In order to accomplish our shared mission, we work across 4 main activity buckets, which connect the regional and global LCs. First, we work together to document and share experiences related to cross-cutting work on social norms and agency. We also dedicate resources and time to strengthening and sharing capacity and knowledge on social norms and agency with others, both within our networks and externally. In order to continue to grow and build our network, we are constantly working to strengthen new partnerships to improve global practice, which often includes providing technical assistance, guidance, or consulting on social norms components of projects. Finally, we are often working to co-create and develop resources focused on social norms and agency and how those concepts intersect across different sectors within global work. And so this combining of activities is what brings us, the Learning Collaboratives Network, together today to share with you information on evidence related to social norms interventions to improve outcomes for adolescent girls and young women in sub-Saharan Africa and South Asia. Next slide. The Learning Collaboratives have recently launched a new website, so please scan this QR code, go to this link to explore more about the Learning Collaboratives, join us, see some of our resources, and we'll also share the link in the chat shortly. Next slide. And with that, I'd like to get us started today by introducing our first presenter. Serving as the Director of Strategic Engagement and Impact at the Center on Gender Equity and Health, Courtney McLaren bridges implementation, research, learning, and capacity strengthening, particularly in support of locally driven, evidence-informed strategies for scale. She brings over a decade of experience in social norms and behavior change, family planning and reproductive health, gender equity, male engagement, and gender-based violence prevention. And with that, Courtney, I'll hand it over to you.
Thanks, Hunter. Yeah, thank you. It's so great to see everyone introducing themselves in the chat. So hi, so many people I haven't seen in such a long time. Yeah, I'm excited to be here on behalf of the team to represent the work of what's been very, very many people. Let's go to the next slide and dive right in. I think you can go 2 slides forward, why not? So I'll be talking about our global evidence review. I'm going to kick us off with the results part of this session before our breakouts. But this is, our global evidence review. This is really representing this report you see on this slide. So it's formally called The State of the Evidence, Effects of Social Norms on Health and Livelihood Outcomes for Adolescent Girls and Young Women in Low and Middle Income Countries. I'll just keep referring to it as the evidence review. But I should say it is primarily focused on sub-Saharan Africa and South Asia, as Hunter mentioned. Let's go to the next slide. So we conducted a rigorous scoping review to assess and synthesize the evidence, to date to explore the relationship between social norms and key outcomes, such as outcomes in sexual and reproductive health, gender-based violence, child early and forced marriage, as well as economic empowerment. We also focus this review on some specific programming approaches. So documenting of what works in engaging trusted leaders like faith and cultural champions, and then secondarily in using or leveraging entertainment media to reach these groups. Next slide. Thanks. So we identified 408 unique resources, and you see our review process here on the slide. And I won't get too much into the methods, right? So we did this rigorous scoping review. And in terms of inclusion, we were really focused on evidence or programs that specifically or directly addressed or worked with adolescent girls and young women. And like I mentioned, in sub-Saharan Africa and South Asia. We were looking at records published within the last decade where we know primarily a lot of the work has taken place. And we looked at peer-reviewed literature, and we did that through several search engines, but we also looked at great literature. So we were pretty inclusive in our approach because we wanted to capture, again, those programmatic areas and insights that might be limited in some of those traditional publication outlets. And I will just say here, we vetted our results through a few collaborative processes. So we conducted in-country sense-making workshops that we brought lots of folks together in, and we had a very wonderful and collaborative advisory board who I see members here today. We're very grateful for their inputs. The final report includes 4 different modules tailored to different content, or you can read the whole thing. And what I'll do for the rest of my time is I'll share insights on each one of the modules as I go forward before I hand it over to our country deep dives. Next slide. Thanks. So module 1, it considers the state of the evidence. Evidence came from 43 countries across those 2 regions, with most of the evidence concentrated in East Africa, West Africa, and for South Asia in India. The studies ranged from, type. So there were lots of exploratory studies, qualitative studies. There were plenty of descriptive studies and plenty of explanatory studies, cause and effect, really evaluating programs. Of those, fewer than a quarter use sort of rigorous randomized control trials or strong counterfactual designs in their studies. And in this module, you'll see if you dig into it that we get into the quality and the breadth of the evidence. And this graph here really shows kind of how the evidence base has been growing significantly within this time period. So really kind of speaking to the work that's been done. But we also get into some of the challenges in the evidence base, and that comparability across studies can be quite limited still because only a minority are still measuring norms directly or using sort of comparable methods to measure norms. So you can join a breakout group to talk about that more. And finally, in this module, we also get into what kind of norms are being addressed in these programs, sort of a qualitative look at the types of norms. And you see for adolescent girls and young women, we're primarily, building an evidence base around gender norms, gender roles, norms around fertility and family size, and violence-related norms were the most common ones addressed with this group. Meanwhile, there's less attention that's been given to norms around bodily autonomy, menstruation, agency, or sexuality. So it could be a gap. Next slide. Great. So our second module deals with the drivers of social norms. And for us, a big takeaway is that targeting surface level norms may work for some programs, and indeed is, but may not be enough for others. So in this module, we kind of get into, that deeply rooted norms around gender and power keep shaping outcomes for adolescent girls and young women. Of course, we know this because norms are not existing in isolation. They're tied to many larger factors, laws, institutions, health systems, which can reinforce them or also be opportunities to intervene. And another insight in this module, which we all know, is we get into some sort of the directionality of norms or where they come into the pathway of change. And specifically, an insight we glean with adolescent girls and young women is that for types of social norms, the norms that are really closely linked to social sanctions. For example, for a young girl to use contraception may lead to a perception that they're promiscuous, and that could drive social seclusion or ostracization. Those were very common with adolescent girls. So norms tied to social sanctions were very common in the evidence base, and really we need to pay more attention to those kinds of norms, and we get into that the norms matter for gender and context with this group. And we can go to the next slide. So in terms of the program pieces, module 3 deals with trusted leaders, faith and cultural champions. And our takeaway here is they're really widely engaged in programs. We didn't just identify a few, we identified many, but the evidence is still thin on what makes engaging them really transformative. And we're really trying to contribute to that evidence base in this review. So we looked at 41 interventions, most of them in sub-Saharan Africa, most focused on family planning and gender-based violence. And we found that layered strategies were most common, right? So they're engaging groups through dialogue, reflection, diffusion, links to health services, sort of multi-component programs. And they're showing strong results on attitudes and behaviors as well as norms when measured. But we also saw a lot of kind of qualitative reflections about these programs really are working when they're, of course, as we know, well aligned with community values. So it wasn't so much those pieces over the implementation characteristics. So we really want to kind of get into the how-to more in the evidence base. And then we can go to the next slide. So for entertainment media, our review found that approaches were very, very successful, but especially when they're paired with interaction, so in-person interaction, and really bringing in reference groups. So here we looked at 49 interventions, likewise in sub-Saharan Africa predominantly, as well as addressing gender-based violence and family planning. And here we saw that both short interventions and long interventions worked. They were both effective. But like I said, that strategy really mattered. So bringing the entertainment media space to the community in discussion with reference groups was a particularly big insight for our team and a contribution of what the evidence is saying. I will say, kind of just to close on both of these two programmatic modules, is there was limited information on cost, on scale, on sustainability. So we really want to emphasize kind of building that up. And let's go to the next slide. Okay, great. Yeah, so to close, for us, if there's one big takeaway, right, it's that we can continue to strengthen this evidence base. As I've mentioned, to continue to chip away at better measurement, but also learning together as a community. And like I said, that really starts with better program documentation to capture what's really important. So we want to prioritize reports and learning with each other on how implementation is going. We also have a few other insights here, like improving our theories of change, documenting why shifts are happening and what we're expecting, improving our monitoring system. So we're capturing not just what's successful, but also where we're seeing kind of pushback and different signs of change. Like I said, cost, scale, and sustainability are a bit of gaps. And a final point I'll end on is one takeaway is that, we really want to continue to center the adolescent girl in this process. And so we had limited information on how adolescents are really engaged in the design of these programs. And it would be great to hear from folks in breakout groups and to bring more of those program examples of how adolescents are engaged in norm shifting programs to the forefront. Great. With that, let's turn it to the next slide and let's introduce our next speaker. So Haishat is going to join us next. She's a public research health researcher who conducts comprehensive evaluations, develops actionable insights, and implements effective solutions tailored to the unique needs of West Africa's underserved population. So she's going to join us and she'll share the insights from our first country deep dive from Nigeria. Haishat.
Thanks, Courtney. Please go on to the next slide. Next slide, please. So, hi, everyone. I'll be talking us through the country-specific deep dive that we did in Nigeria. And as sort of like a background, we all know that patriarchal norms are some of the things that hinder health and well-being of adolescents and young women, adolescent girls and young women in this country. And because of this, we kind of springboarded off the global evidence review, and we decided to do kind of like a deeper dive into Nigeria, just for additional context on what is more focused on what Nigeria does. So our focus was to review how interventions engage faith and cultural champions and entertainment media to shift harmful norms around sexual and reproductive health, women economic empowerment, gender-based violence, as well as gender-based violence, as well as sexual and reproductive health. Next slide, please. So what we did was to review a couple of sources, technical reports, published articles and conference papers that showcase work that has been done around social norms programming using FCC and EM that address CFM, sexual and reproductive health, WEE, that's Women Economic Empowerment, and GBV. And we also conducted stakeholder consultation, that's expert engagement. This is actually us trying to validate some of the findings that we had during the desk review, as well as get additional insights to some of those things that we found. Next slide, please. Some of the results we found showed that interventions mostly deployed FCC approaches. I think this is just because making use of faith and cultural champions was sort of like a low-hanging fruit, as well as the entry point to any community that you'd want to address things as dicey as women economic empowerment, agency, sexual and reproductive health, gender-based violence. This thematic areas extremely dicey in this country. And so because you have to get the buy-in of the faith leaders, the traditional leaders, because of how diverse this country is, many interventions have had to leverage them to be entry points to any community that they intend to engage in. Entertainment media was also used, and what we found was that for geographical focus, which we showed here, we had more of our interventions in northern Nigeria than southern Nigeria, which shows kind of like a gap in regional documentation of social norms programming in this country. For duration, entertainment media seems to last for a longer period of time, although it doesn't particularly show evidence that there's a norm shift, but there are documentation of behavioral or attitude shifts. Then the intervention approach, each of them use at least one contemporary method, entertainment media method, which kind of tells us that programmers are shifting from the more traditional platforms to digital and mobile technology. Norm shifting approaches that use entertainment media and FCC have been seen to actually help shift attitude and behaviors of the people in this community, but not necessarily norm shifts, according to the documentation. Next slide, please. So some of our key findings with respect to impact measurement as well as sustainability. For impact measurement, we saw more of output and process measurements. This were more for programmatic use and not necessarily in the measurement of shift of norms. So indicators such as social media engagement rate, online interaction, which can only showcase how much of attitude or behavioral shifts has been noticed. Those are the only things that we're able to find, especially with EM programs. And outcome measurement. So a few of the interventions that we found were able to use things like behavioral surveillance surveys, uptake of sexual and reproductive health, increased uptake of SRH services, compliance with vaccination schedules, and more. So these ones were able to show that even at that, it was more norms, it was more attitudinal and not necessarily norms measurements. Insights on these measurements, all of them were just basically showing us shifts in attitude, not necessarily norms. Next slide. Next slide, please. Thank you. So for sustainability measures, how these interventions were able to, how these, the previous slide, please, how these interventions were able to ingrain, yes, thank you. How they were able to ingrain their approaches such that whenever the funding or the program ends, the impact of their intervention actually lasts beyond the program duration. So continuous training, they continue to train their religious and traditional leaders, which created some degree of ownership. Partnership, they were able to partner with government bodies and even Sharia commissions where Islam is the predominant religion, such that the teachings and the sermons are something that they can pass to even the younger religious leaders. And then community focus, it was more about the community. They tried to help them understand that this is theirs, and even after they are gone, it's theirs to use, and it's they were able to speak to them in a context that you'd be able to understand religiously and traditionally. Next slide. Next slide, please. So in conclusion, we had a few recommendations for programmers, implementers. They needed to design with intention, understand that these people that you're going to meet, they already had existing cultures, existing traditions. So you design with the intention that you're not exactly shifting their mindset or removing their culture, but that you're just bringing messaging that would help them. And then strengthen measurements and adaptive learning. One thing that we found is that measurement was almost non-existent. So we need programs to be able to design their interventions in a way that you understand the hows and whys behind the change. And then scale up work to prioritize sustainability. And lastly, we need to close evidence and drive innovation to ensure continuity of these norm shifting interventions beyond the pilot phase. So I'll please move on to the next slide. So I'll introduce our next. Yeah, so presenting for Kenya would be Stella Bosere. Dr. Stella is a medical doctor, lawyer, global health practitioner, researcher, and author with over 14 years of experience advancing gender equality, health equality, and inclusive governance across Africa. So she'll be taking us through the findings from Kenya. Over to you now, Stella.
I shall be sharing my slides also, and they will be shared by the team. So in terms of background for Kenya, what we've noticed over the last couple of years, particularly the last decade, social norms around masculinity have really become a central focus for improving health and well-being outcomes among adolescent girls and young women. And specifically centering it around faith and cultural leaders, acting as moral reference points, reference points able to legitimize this shift, and entertainment media, which has created emotive visual narratives that have shaped the perception of masculinity among the youth. So our analysis looked at 29 programs that leverage on faith and cultural media, and 15 that looked at entertainment media to challenge harmful gender norms that promote positive care-based masculinity to improve adolescent girls and young women. Our methodology that we use, like Nigeria, we had primary and secondary data. We did a lot of deep dive in data sources, looked at great literature, we looked at academic papers, but most importantly, we evaluated a number of programs that were used, that had been implemented by the partners in Kenya. We applied a number of analytical frameworks. We're looking at social norm theory, looking at in what direction, how does the change, the social change comes in, the norm change comes in. Is it directional? Is it mediating? Is it moderating? And then we also looked at the continuum of masculinity in terms of moving from harmful to protective, and did a deep dive on reference group analysis, basically identifying key influencers. Who are these faith leaders? Who are these peers? Who are these media creators? And finally, how these pathways of change came into being. In terms of the FCC, the Faith and Cultural Champions, the modalities around the strategies that we came across, most of them had barazas, which is just a convening of old people and interfaith practitioners. We also had some of them go through gender transformative training. There are also a number of public declarations that denounce harmful practices, and there were intergenerational facilitated dialogues on masculinity and decision making to look at power sharing. There was also partnering, a number of them also partnered with women-led grassroots for advocacy and norm change, and those that leverage on scripture to promote empathy, inclusion, and rights. Where we saw in terms of where the norm change, in terms of what emerged, is that from control, we saw a change from control to dominance, from control and dominance to more care and responsibility, from silence to emotional suppression to more vulnerability and help seeking, from sexual entitlement, particularly around sexual violence, to more mutual consent and respect in relationships. And for girls, for adolescent girls, in terms of child and forced marriage, we saw a shift from them looking at young girls as materials for marriage to young people who can be leaders and students, and men moving from a sole decision maker to a more inclusive and community-driven decision maker. And so this encouraged positive male engagement, shifted perception of masculinity, created new models of manhood rooted in faith, empathy, and nonviolence, but also promoted positive relationship and consent. The key takeaways around the FCC is that it really did build a strong moral authority and a wide reach, effective in contextualizing it within narratives around messaging. And they had multiply effect around positive masculinity that moved from them to the rest of the community across all genders. The only risk was around tokenism and resistance. And this is something that, particularly when it comes to inclusion of communities like the LGBTIQ. There were a number of extrinsic factors that take into account. FCC, one of them was the legal and political environment. Restrictive laws could not allow conversations around abortion, conversations around contraception, conversations around sexual and gender minorities, and also the freedom, the right to consent. And there's also a lot of politicization of religion and culture, and weaponizing by leaders, religious fragmentation because you have different sects, and finally, the silo way in which funding and donor agendas are also pushed through to communities. On entertainment media, in terms of the implementation strategy, we saw a number of them use standalone formats like films, TV, video, radio, versus those who use multimedia campaigns, where they incorporated both electric print and also social media and community dialogue. There are a number of iterative formats like SMA pooling, WhatsApp, and also discussions that created more impact using drama, satire, music, and digital storytelling. And this key was looking at messaging tailor-made for men and boys in terms of role models, building empathy, and responsibility. Where we've seen in this program, what was emerging from the data, was that there was a move in terms of the norms that were emerging, a shift from hypermasculinity to diverse expression of masculinity. So we saw reports talk about characters challenging toxic masculinity and celebrating alternative masculinity that is rooted in emotional presence, care, and empathy. We saw a change from sexual contest and pressure because of this narrative that was shifted to respectful relationships and consent, and moving from violence as power to non-violence as strength. For girls, particularly around child and enforced marriage, we saw a shift from girls, AGYWs, as being passive recipients to those who are promoted in terms of agency and voice, and young girls being portrayed as making bold decisions, challenging community expectations. And stigma around SRHRs was also destigmatized, where there's normalization around discussions on sex, menstruation, and contraception. And of course, a cross-cutting issue around mental health. There was openness and conversation that supported health seeking. And so there was a lot of humanization. You humanize the vulnerability of men to be able to move away from hypermasculinity. They modeled consent and respectful relationship, encourage young men to support girls' autonomy and dreams, shifted community conversations around gender equality and SRHR, and combated GBV. The key takeaways around entertainment media, it sparks literally a wide range of attitudinal change through relatable stories, interactive and multimedia format. They outperformed the passive contents, which usually looked at one model. And then the collaborations around young people and creative also build credibility and increased the reach. And there's a huge opportunity for scaling up in high but needs infrastructure and evaluation. Gaps still remain around inclusion of rural, offline audience, and also sexual and gender minorities. A couple of things are also coming out in terms of cross-cutting challenges in programming, and which I want to reframe them as opportunities. One of them is the measurement. Is it attributory or is it contributory? The challenge is it's difficult to isolate a unique impact of either entertainment media or FCC, especially in complex social environment with overlapping initiatives. There is an opportunity to design agenda and adaptive M&D frameworks that would use contributory analysis and qualitative storytelling to capture layered changes over time. There's also around the issue of time lag in norm change. Norms, especially around masculinity, consent, and SRHR, do not shift immediately, and they take a long time, and it's a gradual shift. And so sometimes it's difficult to see that visible change, and the opportunities to be able to develop longitudinal tracking tools or community journaling methods. Finally, is in terms of how it is that we're looking at masculinity as norms. The lack of consistent indicators to track this shift, what are we looking at? Dominance? What are we looking at? Empathy? Can we be able to see how an opportunity for programming, either in FCC or media, codifying these markers of change? Final reflections for all programs. Indeed, masculinity is a central core around AGYW, and they complement each other. They cannot work separate from each other. And so there's need to co-invest and co-create with both FCCs and EM coming together to amplify public discourse and build coalition and sustain momentum. Thank you. Apologies, I've taken 3 extra minutes. Thank you. I'm going to now introduce the next presenter. She's called Dr. Shweta Singh. She's a consultant and academician with over 12 years of experience in social norms, behavioral change, and community engagement. She holds a PhD in social sciences from excuse my heavy Kenyan accent, Wageningen University and Research, which is in the Netherlands, and has published and presented nationally and internationally on gender, food systems, and community development. Karibu, welcome, Shweta.
Thank you, Stella. Hello, everyone. It is a pleasure to be with you today to share the findings from India Country Snapshot. This work takes a closer look at how social norm shifting interventions are playing out in India, building on the global evidence review that revealed a significant gap in literature on norm shifting interventions in India. Next slide, please. Our analysis followed a triangulated approach. We reviewed literature, did secondary analysis of interventions, and engaged stakeholders through in-country sense-making workshop with civil society organizations, donors, media practitioners, and implementers. We grounded our review in theoretical framework, including COMBI model, sociological framework, and behavior drivers. Please, previous slide. Thank you. So the focus of this deep dive was to understand how social norm shift and behavior change occur, particularly through intervention leveraging entertainment media and culture champions. Next slide. In total, over 36 interventions were reviewed across India. Half of these relied on culture champions, nearly a third used entertainment media, and about 1 in 5 combined both approaches. In terms of thematic spread, 42% focused on gender-based violence, followed by sexual and reproductive health, women economic empowerment, and 12% on child, early, and forced marriage. While looking at the duration, nearly half were medium term, lasting between 1 to 3 years, while about one third ran more than 3 years. Next slide, please. Thank you. Entertainment media intervention effective at engaging young audience. Multiple platform approaches spanning TV, social media, chatbots, mobile games reached wider audience at scale. Storytelling emerged here as a powerful tool, reducing stigma, modeling progressive behavior, and creating relatable role models. Examples of the initiatives include MTV Nishad, Ring the Bell, and Go Nisha Go campaign. Yet, only around 20% of intervention tapped into gamification, AI, signaling a clear opportunity for innovation in future. Next slide, please. Culture champion brought the power of trust. These include peer mentors, self-help groups, teachers, religious leaders. They foster safe spaces for dialogue, used creative methods like street theater, role play, flip charts, door-to-door outreach. But by engaging at individual, family, community level, they were able to create more sustainable change. We saw these clearly in initiatives such as Planet Girl, Transformation, and We Can campaign. Another key finding was the engagement of reference group, especially fathers and mother-in-law. Their involvement enhanced both acceptance and impact. From our finding, three elements consistently stood here as essential drivers of norm change, what we call the power trio: peer leadership, local anchoring with trusted community structure, ecosystem engagement that connects multiple actors and levels. Because when these elements come together, interventions gain credibility, broader acceptance, and a stronger potential for scale. Next slide, please. Previous one. Thank you. Despite promising outcomes, persistent gaps remain. The digital divide still restricts access, especially for girls and marginalized groups. Male engagement is often limited, leaving inequities unaddressed. There are risks of resistance or backlash when norms are challenged, particularly by reference groups. And measurement framework often remain weak, tracking attitudes but not deeper social norms. To address these gaps, we see specific priorities. First, designing inclusive interventions that reach girls, women with disabilities, and marginalized groups. Second, embedding robust measurement framework that capture norm shift, not just attitude. Both entertainment media and culture champion offer powerful pathways of shifting social norms in India. As we move forward, addressing digital divide, engaging men and boy meaningfully, and strengthening evidence on norm shifting will be a key to creating sustained inclusive progress. Thank you.
Hi, everybody. Thank you, everyone, for your presentations and for sticking to time. Could we go to the next slide, please? We have just a few minutes, maybe about 5 minutes for questions. So we've answered a lot of the questions along the way. I'm wondering if anyone would like to come off mic and ask a new question. I think you can raise your hand, you can just chat. Lubna, could you please go ahead and ask your question? It looks like, yeah, it looks like Lubna, I'm sorry if I'm not pronouncing your name, you have your hand up. If not, if your hand was about something else. I'm looking at the last question that's open here, which is pretty interesting about whether adolescents are passive recipients or are their choices, shaped by others around them, making autonomy a relational and negotiated process. So would anyone like to sort of tackle that, maybe less of a question and more of a sort of comment about social norms and how adolescents engage with them? You can take a look at the questions, and we also have a question from Nicola. And maybe this, could be for one of our panelists. Untapped potential because only 20% interventions are using AI and gamification. And Nicole is asking for some comments and contextualization on that. And there was another question earlier on other kinds of social media engagement. Stella, I see you have your hand up. Do you want to?
Let me tackle the question around adolescent and agency and autonomy.
Great.
I think this deep dive, one of the things that it came out is that when we're doing a deep dive around the programs in FCC and entertainment media, the core focus was to look at them as barriers and to find opportunities that have been implemented by the different partners to be able to catalyze a space where the adolescents and young women can actually make better decisions about their body with access to comprehensive information and also get the support from the community where they belong. So what the core message is that how do we work with these barriers, for example, around masculinity, to be able to remove those barriers and to create a conducive environment for adolescents to make their own decisions, to make choices. Thank you.
Thanks, Stella. Here's a great question. Oh, I see, Paul, you have your hand up. Paul, do you want to go ahead?
Yes, thank you, Rebecca and the team. My question is about the faith and cultural leaders. In Uganda, in particular, we are grappling. Many organizations that adopted this strategy, and I see from the evidence presented that it works, but it would be good to know a little bit more under which conditions or contexts it works, or what strategies make it work, and when does it not work? Thank you.
Those are what we call like the $100 million questions. Would anyone like to tackle that? Maybe Courtney, would you like to give it a go?
I mean, as you said, Rebecca, it's a very challenging question. So I will make a plug to say there is a devoted webinar on this from our evidence review where we're going to get into more of the specific results from this subset of the analysis. This is on October 29th. Mark your calendars. We'll send the invite out soon. But no, yeah, it was a very challenging question to answer. because we included programs that were including like a range of different leaders or actors, we could call them that. And they may be faith leaning, they may be cultural leaders, and they have completely different characteristics and components, and they're using very different modalities and ways to engage them. So I would just say it's a challenging question to answer. It's sort of unanswerable at this moment, but we are making the case that, I think there are so many programs that are doing it. And if we are including not just peer-reviewed literature, there's a way that we can look more deeply into this and surface a lot of what Highshat was sharing too, like the country level insights on how it's being done. Maybe look more into like the niche angles to try to answer that question instead of doing it at the global level, because it's quite challenging. That's my best answer. Does anyone want to add to?
I think that's a great first take. And we're about to go into our parallel sessions, and we'll definitely dig into a lot of these topics. We don't have time right now to answer the remaining questions, but I do want to just read them out, because as we go into our parallel sessions, I think we'll be able to discuss some of these. And yeah, I think that's what I want to say. So there's a couple of really interesting questions. Because flags, what are some of the structural or systemic barriers or enablers that emerged in the interventions? So I see Courtney's typing an answer. It's something I think that some of the breakout rooms could discuss. There is also a question about what's the biggest academic gap in social norms. Something else I think we can talk about in the breakout rooms. Obviously we flagged measurement, and one of our rooms will discuss measurement, but there are other issues as well in terms of documenting costs, scale up, systematic documentation, so we can look across programs. Those are pulled out pretty clearly in the report, I think, because it's nothing, researchers are very good at identifying the evidence gaps. There's also a really great question here about resistance. How can we, like organizations who are resistant to work on social norms? So I'll put a plug in for one of the parallel sessions. We're going to be talking about the myths around norms shifting and norm shifting programs and what the evidence actually says. We're also working on a series of advocacy briefs to address some of those barriers and myths and help people get program funders and also leaders on board with norms, including norm shifting in their work. And the critical mass question is a great one too. So who's working on reaching the critical mass? Because as you all know, norm shifting is all about that, getting enough people to change, having enough people seeing change to bring about norms change, which is what makes it so different from individual work on attitudes and knowledge. I think with that, let's move on to our parallel sessions, because we have some really interesting topics for you. If you could go to the next slide, Princess. So these are the parallel sessions. We'll have about a half an hour in each session. The first room will be social norms measurement, approaches, insights, and challenges. So we'll be talking Betsy Kostenbader, Brian Shaw, Carrie Jo Clark will be there to have that discussion with you. In room 2, we'll be talking about whether sort of the issue of reference groups. Can men, mothers-in-law, and other influencers be allies? Well, at the same time, they're also obstacles. So I forget everyone who's going to be there, but I know that Sohail will be in that group. We have the third room where we'll be myth-busting social norms. We'll be looking at some of the myths and debunking them. So Vinay Shweta and I will be in that group. And then in our final room, shifting norms ethically, who decides what should change? How do you do this work ethically and effectively? Courtney and some other folks will be in that room. So I think with that, we will pull up, are the rooms, I'm not seeing the rooms yet. Are the rooms open for us to move into? Just, you can choose any room you like. We'll have about a little bit less than 30 minutes. Then we'll come back and we'll have some closing remarks from Lee Stefanik from the Gates Foundation, who is our fearless leader who's been guiding this work from the Gates side.
For the rooms, we're actually going to be going to, each room has their own link. So we're just pulling those together. If you could give us just 1 second to get there. And in the meantime, feel free to put any other questions you have in the chat. And then we'll come back here.
Great, thanks. We can take a look at that. There's some great questions. Hi, Ancha. So Ancha's asking about engaging SBC implementers. We do have implementers involved in the review. We have them on our advisory board. Someone you know quite well, Callie Simon and Jen Gales, were on our advisory board. And of course, that's what the deep dives and our sense-making work was. But really importantly, now that we have the results, sort of translating those results into information and knowledge in a way that implementers can use is really critical. And we'll be working on that over the next year. So your point is very well taken about making sure that the evidence is translated in a way that's usable for those who need it. Thank you, Rachel, for sharing that article. We will be excited to peruse it. Online narratives around masculinity and anti-feminist narratives aimed at young boys and men. Yes, there's that came up quite a lot in our sense-making workshops. I don't know, would any of our Learning Collaborative partners, or maybe Sohail, would you like to comment on that? Reflections on online narratives around masculinity and anti-feminist narratives. I'm not hearing any takers on that yet.
Hi.
Hi, Paul. Do you want to comment about men?
Can you say that again? Sorry.
Oh, I was asking if you wanted to comment on masculinity and men online. I know we have a lot of people on this call who are experts in this topic.
Yeah, I prefer to wait for the others. They are ready.
All right, what I will say is that in all of the countries, sort of what we kind of framed as backlash and was a really important part of what we found in the review. And that's why you'll see in the review, we really highlight the need to address backlash to engagement in boys, in a thoughtful, positive way, because of course they are part of the sort of the reference groups and the power holders that are going to influence adolescent girls and young women. And yeah, I think I'll leave it there.
Rebecca, we're ready whenever
okay. Yeah, we're ready. Go ahead.
So I've just put in the chat the links to the different parallel sessions. As a reminder, parallel session 1 is on social norms measurement, approaches, insights, and challenges. Parallel session 2 is on hot button topics, allies or obstacles. Parallel session 3 is on myth busting social norms. And 4 is shifting norms ethically, who decides what changes. So please join the respective link. For parallel session 3, you're going to be staying here. Lucky you gets to stay here. And all the others, please find your respective links. And then we will make sure that the link to this is back with your group so that you can come back and join here the last 5 minutes. We really appreciate your patience on that technical glitch that we had, but we're excited to see you all in your respective rooms. So please feel free to join those links. We'll be joining you there shortly.
Thanks, Hunter. And this is your opportunity for those deeper discussions that I know we all want to have recording. And I think with that, it looks like everyone's back, and I can turn over the mic to Lee, who's going to make some final comments.
Hello, everyone. Wow, just in time. I had to tear myself. It was really hard away from the group. Someone was about to say something really consequential, so I'm glad I made it in time, but they're just joining. I was in the ethics group. So hello, everyone. My name is Lee Stefanik. It's so nice to see so many familiar names, and I just hope there's an opportunity to see many of you in person in the near future. It's been a while. I enjoyed the rich discussion today and hearing your perspectives. As I just mentioned, my last group was really lively, so I hope you had the same experience. I'm grateful to the Learning Collaborative and the Center on Gender Equity and Health for creating this opportunity for exchange. I just find them really valuable, and I've been looking forward to this for a very long time. So thank you for that. We began by asking what really drives social norms change to improve health and lives of adolescent girls and young women. And the combination of your perspectives and this evidence help us piece together a picture that is both complex and also hopeful. There are a few ideas that resonate with me that I think could help take us forward. There's clearly a lot that we learned today, but this is a combination of some things that are bubbling up and that I heard today that are really sticking with me overall. First, there's an opportunity to bridge new kinds of partnerships to amplify community-led change. These findings encourage us to seek solutions through collaborations that bridge creative industries and trusted leaders with researchers and local youth champions to accelerate the changes that girls and women themselves want to see. These alliances will be where the next generation of solutions emerges. Number two is I'm particularly excited about the new global and country evidence and insights on pathways of norms change. This evidence offers the opportunity to prioritize strategies to enhance normative impact. So I encourage you to look through some of the reports at what's really resonating across these evidence bases, because it's really quite a needed contribution that I'm always looking out for, and that I appreciate the insights from this. A third opportunity I see is to strengthen the case for norms work by deepening the evidence on scale, cost, and sustainability. Particularly, evidence on cost effectiveness of programs to improve norms and adolescent girls and young women's outcomes has great potential to make a compelling case in an environment of trade-offs. And there is better guidance than ever before to develop mixed methods, norms, measures, which are required to build this evidence. Finally, I'll highlight the value of spaces for sharing and discussion like this one. As the landscape for this work shifts, it's more important than ever to continue gathering within and across geographies and disciplines to reflect, learn, and refine our efforts together. Thank you for continuing to be a part of this important learning journey. I'm so pleased to see both familiar and known faces with new ones. It just demonstrates to me how we're bringing more people into the fold and bridging gaps across different disciplines and regions. So I think that's just going to be all the more important going forward. So thank you for the work that you continue to do and for taking so much time today to be with us. Thank you.
Thank you, Lee, and thanks everyone for joining us today. It was really a privilege and an honor to have you join us. If you'd like to learn more about the Learning Collaboratives or see our resources, you can go to this link here or use the QR code. And of course, we hope you'll all peruse the report. We'll be sharing out the slides, the whiteboards, the materials from the breakout groups. So have a great day, a great afternoon, a great evening, and please do join us for our next webinar, which will be diving in on trusted cultural leaders and faith champions and trusted leaders. And good luck. We'll see you all soon.
Thank you.